Hey everyone, this is Ashley with the Human Resources Department here at Global, and today I'm going to talk to you about Global Concepts Charter School's Airborne Infectious Disease Exposure Prevention Plan. We'll start here with an overview of the plan. So the purpose of this plan is to protect employees against exposure and disease during an airborne infectious disease outbreak. The plan goes into effect when an airborne infectious disease is designated by New York State's Commissioner of Health as a highly contagious communicable disease that presents risk of harm to the public health. This plan is subject to any additional or greater requirements arising from a declaration of a state of emergency due to an airborne infectious disease. Employees may report questions and concerns to the designated contacts of this plan. So for the K-8 and high school buildings, including the Fine Arts Center, the designated contacts will be the building principals. For the central office, the designated contact will be the human resources specialist. So this plan does apply to all employees as defined by the New York State HERO Act. So that means any person providing labor or services for a private entity or business within the state without regard to an individual's immigration status and shall include part-time workers, independent contractors, domestic workers, home care and personal care workers, day laborers, farm workers, and other temporary or seasonal workers. The term also includes individuals working for digital applications or platforms, staffing agencies, contractors, or subcontractors on behalf of an employer at any individual worksite, as well as any individual delivering goods or transporting people to or from the worksite on behalf of the employer, regardless of whether delivery or transport is conducted by an individual or entity that would otherwise be deemed an employer under this chapter. The term does not include employees or independent contractors of the state, any political subdivision of the state, a public authority, or any other governmental agency or instrumentality. You may refer to the New York State Department of Health and Labor website for information on whether or not the designation has taken into effect. Currently it has, which will be discussed in a different training section. No employer is required to put a plan into effect absent such designation by the Commissioner of Health. So responsibilities under this plan. This plan applies to all employees of Global Concepts Charter School and at the following work sites. So we have our K-8 building on Ridge Road, our high school on Johnson Street, our Fine Arts Center on Roland Avenue, and our central office on Abbott Road. The following supervisory employees are designated to enforce compliance with this plan. At the central office, we have our CEO, Tracy McGee, our Human Resources Specialist, Deanna Malley. At the K-8 building, we have our K-8 principal, Jack Turner. At the high school, we have our high school principal, Liz Mastromadio. Exposure controls during a designated outbreak. So during an airborne infectious disease outbreak, the following minimum controls will be used in areas of the worksite. So number 1, general awareness. Individuals may not be aware that they have the infectious disease and can spread it to others. Employees should remember to maintain physical distancing, exercise coughing or sneezing etiquette, wear face coverings, gloves, PPE as appropriate, limit what you touch, stop social etiquette, so that's your hugging, your handshaking, washing your hands properly and often. Number 2, the stay-at-home policy. If an employee develops symptoms of the infectious disease, the employee should not be in the workplace. Employees are instructed to inform the school nurse and follow New York State Department of Health and CDC guidance regarding isolations and medical care. Number 3, health screening. Employees will be screened for symptoms of the infectious disease at the beginning of their shift and are to self-monitor for symptoms throughout their shift. New or emerging signs or symptoms should be notified to the nurse, and the employee should be removed from the workplace. The health screening elements will follow guidance from New York State Department of Health and CDC guidance if available. Number 4, face coverings. So face coverings and physical distancing should be used together whenever possible. Employees will wear face coverings throughout the workday as designated at any given time. The face covering should cover the nose and mouth and fit snugly but comfortably against the face. Number 5, physical distancing. So physical distancing will be followed as much as feasible and will be determined by current guidance. In situation where prolonged close contact with other individuals is likely, the following control methods should be used. So that would be your signage, your floor markings, telecommuting, remote meetings, you're restricting travel, restricting or limiting customers or visiting entry, and limiting occupancy, for example. Hand hygiene. To prevent the spread of infection, employees should wash hands with soap and water for at least 20 seconds before and after touching eyes, nose, mouth, touching your mask, entering or leaving public place, and touching an item or surface that may be frequently touched by other people. So those are your door handles, your tables, gas pumps, shopping carts, electronic cashier registers, for example. Cleaning and disinfection. We will touch base on that in a different section. Number 8, respiratory etiquette. Employees should exercise appropriate respiratory etiquette by covering nose and mouth when sneezing, coughing, or yawning. Number 9, special accommodations for individuals with added risk factors. We do ask that you inform the HR department if you fall within this group and need an accommodation. Advanced controls during an outbreak. For activities where the minimum controls alone will not provide sufficient protection for employees, additional controls may be followed. Global Concepts Charter School will determine if the following are necessary and are subject to change based on operations and circumstances surrounding the infectious disease. So number 1, elimination. Global Concepts will consider temporary suspension or elimination of potentially hazardous activities where adequate controls cannot provide sufficient protection for employees. So that could be eliminating or limiting in-person learning, gatherings. So that means, moving the location of your gathering to, outside and lowering it to a much smaller scale. Number 3, here, limiting or eliminating in-person recreational and or sporting events. Number 2, engineering controls. Global Concepts will consider appropriate controls to contain and or remove the infectious agent, prevent the agent from being spread, or isolate the worker from the infectious agent. Engineering controls that are anticipated to be used are the following. So we have mechanical ventilation. For example, that is your exhaust ventilation or your local duct. General ventilation would be increasing the percentage of fresh air into the air handling systems, avoiding air recirculation, so utilizing air filters, things like that. Natural ventilation, for example, could be opening outside windows and doors, maybe opening a window on one side of the room and having a fan on the other side of the room. Number 3, administrative controls. So Global will consider appropriate policies and work rules to aid in preventing exposure. Administrative controls that are anticipated to be used are as follows. Increasing the space between employees and students, disinfecting procedures for specific operations, employee training, cross-training employees to ensure critical operations, limiting the use of shared workstations, prohibiting eating and drinking in the work area, and even, posting signs reminding of respiratory etiquette, masks, hand hygiene, etc. So PPE, so devices like eye protection, face shields, respirators, and gloves that protect the wearer from infection. So the following PPE that can be anticipated to be used would be your disposable surgical face masks, your N95 respirators, your face shields, your eye protection, gloves, and gowns. Exposure control readiness, maintenance, and storage. The controls we have selected will be obtained, properly stored, and maintained so that they are ready for immediate use in the event of an infectious disease outbreak, and any other applicable expiration dates will be properly considered. So number 1, housekeeping during a designated outbreak. Objects that are touched repeatedly by multiple individuals must be cleaned frequently with an appropriate disinfectant. Surfaces that are handled less often or by fewer individuals may require less frequent disinfection. Adjustments to normal housekeeping procedures. Normal housekeeping duties and schedules should continue to be followed during an infectious disease outbreak to the extent practicable and appropriate consistency with the New York State Department of Health and or CDC guidance in effect at that time. If an employee develops symptoms of the infectious disease at work, it is ideal to isolate the area in accordance with the guidance issued by New York State Department of Health and or the CDC before cleaning and disinfecting the sick employee's work area. As feasible, liners should be used in trash cans. So you should empty the containers often enough to prevent overfilling. And we ask that you don't forcefully squeeze the air out of the trash bags before trying to tie them closed. Infection response during a designated outbreak. So we will instruct the sick individual to wear a face covering and leave the worksite and follow New York State Department of Health and/or CDC guidance. The individual will be required to inform the school nurse and follow Global Concepts COVID-19 containment, testing, and contact tracing plan. Follow local and state authority guidance to inform impacted individuals. Training and information during a designated outbreak. Global Concepts will verbally inform all employees of the existence and locations of this plan, the circumstances it can be activated, and the infectious disease standard, employer policies, and employee rights under the HERO Act. When this plan is activated, all personnel will receive training which will cover all elements of this plan and the following topics. Number 1, the infectious agent and the diseases it can cause. 2, the signs and symptoms of the disease. 3, how the disease can spread. 4, an explanation of this exposure prevention plan. 5, the activities and locations at our worksite that may involve exposure to the infectious agent. 6, the use and limitations of exposure controls. And 7, a review of the standard, including employee rights provided under Labor Law Section 218B. The training will be provided at no cost to employees and will take place during working hours. The training will be appropriate in content and vocabulary to your educational level, literacy, and preferred language, and the training will be provided verbally, in person, or through telephonic, electronic, or other means. Plan evaluations during a designated outbreak. Global Concepts Charter School will review and revise the plan periodically upon activation of the plan and as often as needed to keep up to date with current requirements. So lastly here, retaliation protections and reporting of any violations. No employer or his or her agent or person acting as or on behalf of a hiring entity or the officer or agent of any entity, business, corporation, partnership, or limited liability company shall discriminate, threaten, retaliate against, or take adverse action against any employee for exercising their rights under this plan, including reporting conduct the employee reasonably believes in good faith violates the plan, or airborne infectious disease concerns to their employer, government agencies or officials, or for refusing to work where an employee reasonably believes in good faith that such work exposes him or her, other employees, or the public to an unreasonable risk of exposure, provided the employee, another employee, or representative has notified the employee verbally or in writing, including electronic communications, of the inconsistent working conditions and the employer fails to cure or if the employer knew or should have known of the inconsistent working conditions. Notification of a violation by an employee may be made verbally or in writing and without limitation to format, including electronic communications. To the extent that communications between the employer and employee regarding a potential risk of exposure are in writing, they shall be maintained by the employer for 2 years after the conclusion of the designation or 2 years after the conclusion of the governor's agency declaring emergency of a high-risk disease.